Here's a chronic low back pain protocol. This is for the person that has ongoing lower back pain that does not seem to be solved by simple factors like a few chiropractic adjustments or some acupuncture or massage or a little bit of stretching or some physical therapy or a little bit of time. This is for the person now that is having trouble getting rid of this lower back pain protocol. And I believe, and I find this in my practice now 30 years going, that people with chronic low back pain is a huge number of people. We know in the United States that 1 of 2 adults has chronic pain. The number 1 site of chronic pain is the lower back. It's extremely common. It's the number 1 part of the body that has chronic pain. So looking at this list, we start off with chiropractic care. Now, chiropractic care is more than going to be a week or 2. Again, if you have a badly sprained ankle, how long is that going to last? That's right, months. How much physical therapy are you going to go for that situation? It's going to be many months of physical therapy before you know that that therapy is going to get better. Or if you have, unfortunately, a joint replacement surgery, how much therapy are you going to need after that? It's going to be many, many months. So with chiropractic care, it's probably going to take months. And then after you do corrective chiropractic care, then you do maintenance chiropractic care. Number 2, the thing that nobody ever talks about with chronic low back pain is decreasing systemic inflammation. You do that with your dietary considerations. So your dietary considerations, taking a word from Dr. Mark Hyman, is a Pegan diet. It's a cross between paleo and vegan, which means you go with a high vegetable diet. If you're going to be a meat eater, meat ends up being a condiment. Vegetables and resistant starches end up being the main bulk of your meals. That's going to decrease your systemic inflammation. That occurs by decreasing your insulin response every time that you eat. When you decrease your insulin response, you decrease systemic inflammation. If you decrease systemic inflammation, you decrease the sensitization of your pain nerve endings. So whether it's a bum knee, a bad lower back, a chronic neck, migraine headaches, gastrointestinal problems, or a brain that's not working, if you do the Pegan diet and stick with that, so you're eliminating dairy products, you're eliminating gluten, you're eliminating or significantly reducing sugar, you're eating all organic, no GMO, no glyphosate Roundup foods, you buy local when you can, you read ingredients like a hawk. You would do that for your child. You wouldn't put anything injurious into your child, so you do the same for yourself. So that's the Pegan diet that you would go on, and you have to give that time to work. Number 3 would be supplements that decrease systemic inflammation. Supplements that do that is you have to look again at your omega-6, omega-3 fat ratio. You need to crank up your omega-3s. I talked about the studies in prior shows on doing that for chronic pain people. You're going to need antioxidants like B, C, D, magnesium, selenium, alpha-lipoic acid, N-acetylcysteine, coenzyme Q10, to mention a few. You'll need all of those anti-inflammatory supplements. Next is you're going to have to do water. So you make sure that you're drinking enough water. If you have any medical conditions, you need to check with your doctor before you do any of these things, particularly water. So you have to look at medications and check with your doctor about that. But the rough thing is, and please go watch my show called Water Rules, drink half your body weight in ounces per day. You will say, I don't want to do that because I'll be up all night peeing. Well, what you do is you drink most of that in the beginning of the day, starting off in the morning, a lot of it in the afternoon, taper off to none in the evening. So drinking enough water. Reducing your stress. So there are techniques and methods in doing that. Check my website, look at my videos on how to reduce chronic stress. If you get that HPA axis, that hypothalamic pituitary adrenal axis cranked up with chronic stress all the time, you're going to be releasing cortisol all the time. That's going to shut down your serotonin and your dopamine, which makes you feel good. And that's going to release the chronic stress hormones. You're going to get an insulin release from that cortisol all the time. And again, that's going to sensitize your pain nerve endings all the time. And you wonder why your chronic pains are not getting better. Get that addressed. I have a low-level laser in my office, a class 2 laser. Mine is from the company Urconia, which is doing most of the research, the bulk of the research on laser for a variety of applications, including chronic pain. It now has FDA clearance for low back pain. I have a low-level laser in my office. I've been using that for 14 years now. Great result. If you've never used a laser, that's the time to do it. This is a cold laser. It does not generate any heat. Extremely safe, so I recommend cold laser. Of course, you need exercise, general physical exercise to your ability. If you have not been exercising for a while, check with your doctor, find out what's appropriate before you get started. And then, of course, you need appropriate spinal stretches. This might be in combination with what you learn at your chiropractor's office, and I have videos on that, of course, what your physical therapist may have showed you, what you might learn from massage therapist, whoever you might be working with, but making sure you're doing all of these appropriate things. If you have chronic low back pain, check this list, see if there's anything on here you might be missing, give it a shot, let me know what your results are. If you're watching this on YouTube, then give us a comment and give us your feedback so we can help each other. I'm Dr. Scott Fuller.